This with Dr. Paul Spiegel. He's the director of the Johns Hopkins Center for Humanitarian Health and worked with an international organization at the Rafah border. He's joining us from Baltimore, Maryland. Doctor, it's good to speak to you. This new report from The Lancet is incredibly concerning. What are the knock-on effects of antibiotic-resistant diseases in Gaza and beyond?
Well, thank you. Thank you for having me. It is concerning. It's important to mention that even pre-war, Gaza had a very high antimicrobial rate. So what is probably most concerning right now is that the number of infections that are happening together with a high antimicrobial rate, nearly 67, 68%, means that people are going to get infected. There's going to be more infections, and there is just a significant lack of treatment at this point. It will mean more infections, possibly even amputations, and ultimately more deaths.
Surely this is also all exacerbated by people living in close proximity to each other. The conditions in terms of hygiene are highly unsanitary, and also just not having any access to food or good quality water.
No, absolutely. I mean, firstly, I think it's extraordinary that this study was undertaken at Al Hospital. I really commend the researchers to be able to do something like this in such difficult conditions. Also, we can look at both the pre and the post issues coming up. Firstly, with water, lack of water, lack of resistance due to acute malnutrition, starvation in some cases. The hospitals that are functioning are completely overloaded, so infections are going to be spreading very, very quickly. And most of the wounds, the resistant antibiotic wounds, were actually from blasts, and those numbers are increasing. They're very, very high. And so the problem is, number one, that they're going to be very, very difficult to treat and prevent. And number two is there isn't enough antibiotics, and particularly the right type of antibiotics, available to be able to treat. And so doctors are treating these patients almost with a blindfold and not really knowing the proper treatment to give them due to the multi-drug resistance antibiotics.
And so many of the doctors in Gaza, or those medical professionals who have gone to the enclave, say there isn't even just ordinary medication, just like aspirin, that's accessible to most people. You mentioned there that people don't have enough food. Malnutrition is rife. We're seeing more people literally dying of starvation. When it comes to that, what are the short-term and also long-term effects on the body, especially when we think of very little children who are going through this?
Yeah. I mean, it's horrific because, particularly for children, but even adults, when you're acutely malnourished, the body does not have antibodies to be able to fight back in the same way infections. And so you have microbes that are resistant to antibiotics, you have an increased number of infections, and you have your body that is not able to fight this appropriately. That's number one. And then there are so many other aspects in terms of the short and longer term effects on just acute malnutrition and starvation. And that's going to have longer term effects, particularly for children, everything from cognitive, brain development to physical maturity.
Doctor, if more food is available, and this is best case scenario, say there are 600 trucks a day coming into Gaza with aid of all kind, how quickly then can a famine be reversed? Because one would think that if somebody is highly malnourished, it's simply not a case of just starting to eat food at a rapid pace and at a normal, quote unquote, rate. Certainly it needs to be done in a very structured manner.
Yeah, no, absolutely. So there are a couple problems here. Number one is that it's not just normal food. For people that are acutely malnourished, particularly children, there are special types of food, ready-to-use foods, therapeutic foods that need to be brought in, and they're not being brought in. There's just not enough of that. number one. Number two is that a famine, it's not linear, but really I think we are probably at this point at a tipping point where more and more people are at that edge where they may die from famine. And that, even if you have all the food that you needed right now and all of the proper treatment for acute malnutrition, if that was happening today, we would still sadly likely see a lot more deaths due to this, because it cannot be reversed immediately. It's going to take longer. And to add that those that are already infected with many of the wounds that are not being able to be treated by antibiotics, they will not heal as well either.
Yeah, certainly a lot of repercussions here. And Doctor, it was just last year that you helped produce a report projecting what the humanitarian situation could look like in Gaza in the months and the years to come. How many of those findings from that report have materialized in what's now playing out in the Gaza Strip?
It is, it's worse in many ways than I think we had anticipated, because a lot of the projections that we did had more stable situations of things either getting better, staying the same, or getting significantly worse. But what we've seen is it's been acute. You have acute crises going on. You have food that is being withheld, and then some food to come in, and then food being withheld again. And so it's extremely difficult to make these projections. We've been expecting famine to be occurring for a while now. It's clearly happening. And so I would say the projections that we did were early on, and what we're seeing, I think, is likely worse than what we were expecting, even in one of our worst case scenarios.
Dr. Paul Spiegel, great to get your analysis. We really appreciate your time. Thank you so much.
Thank you very much.